Good day, everyone. I am Aaron Vitale from BSN AP3A. I will discuss the controversial issue here in the Philippines entitled Increasing of HIV and AIDS, Spreading Awareness for HIV and AIDS. So let's discuss the definitions of HIV and AIDS. HIV is also known as the human immunodeficiency virus, the virus that attacks the immune system, specifically the CD4 cells or the T cells, which help the immune system to fight off infection. AIDS is acquired immunodeficiency syndrome, is the very final stage of HIV infections, and it occurs when the immune system is severely damaged at this stage. The immune system becomes so weak that it can no longer fight off the certain infections and disease. So the symptoms of HIV/AIDS are fever, rashes, night sweats, muscle aches, sore throats, fatigue, swollen lymph nodes, and mouth ulcers, rapid weight loss, recurring fever, extreme tiredness, diarrhea, pneumonia, and memory loss and depression. These are the major symptoms of having an HIV or AIDS. The HIV or the human immunodeficiency virus is primarily transmitted through specific body fluids that contain high concentrations of the virus. The main modes of having HIV transmissions include are unprotected sexual contact. The most common mode of HIV transmission is through unprotected sexual intercourse with an infected person. This occurs through vaginal, anal, or oral sex. Second, the contaminated blood and blood products. HIV can be transmitted through exposure to infected blood or blood products. This can happen through shearings of needle or syringes, receiving contaminated blood transfusion or organ transplantation from an infected donor. Third, mother to child transmission. HIV can be transmitted from an infected mother to her child during pregnancy, childbirth, or breastfeeding. However, the risk of transmissions can be significantly reduced with a proper medical intervention, such as antiretroviral therapy during the pregnancy and delivery and avoiding breastfeeding in certain cases. The last one is the sharing of needles and syringes. People who inject drugs and share needles or syringes are the high risk of having the HIV transmissions. Preventing HIV involves adopting a combination of behavioral, medical, and structural intervention. Here are some key strategies preventing HIV. First is safe sex practices. Use condom regularly during sexual intercourse can regularly reduce the risk of having HIV transmission. Male and female condoms are both effective barriers. Second, limit your sexual partners. Reducing the number of sexual partners can lower the risk of exposure to HIV and other sexually transmitted infection. Third, getting tested and knowing the HIV status of both partner, especially to a same-sex relationship, you need to get tested every day or every month and tested regularly. Avoiding sharing your needles or syringes. Using sterilized equipment for medical procedure. Example for this is when you get tattoos, you need to sterilize the things or the needles before injected to your body because you didn't know that needles is used to the infected person or having an HIV person. What are you waiting for? Don't wait. Get tested. We are located at Araneta Center, Cubao, Quezon City, NCR, Philippines. Or may contact our numbers indicated below. Thank you for listening for our discussion today. Ingat!